Hello, everyone. My name is Brian Van Hook, and I'm Regional Director of the Florida Small Business Development Center at FIU. Thank you to the Florida Chamber today for allowing me to do this presentation for you that's focused on COVID-19 business continuity, steps to reopen your business, and also how you can plan for the future and have future success as well. This particular webinar is going to run approximately 35 minutes in length. We're going to cover kind of federal guidelines for a phased reopening, Florida guidelines for phased reopening, business strategies that you need to do to protect your employees and customers, and then also some strategies that you can implement to be successful kind of in the long term and also adjust to the new normal. So with that, let's get right into the presentation. First, who is this guy talking to you? My name is Brian Van Hook, as I mentioned. I'm with the Florida Small Business Development Center at FIU. We're part of the Florida SBDC network. We have about 9 regional SBDCs around the state of Florida, all the way up from Pensacola and the Panhandle down to Key West. And we're here to help you grow your business. And we also assist, obviously, with COVID-19 and hurricanes in regards to business continuity and disaster recovery. My background is I'm a certified business continuity professional, and I have 15 years of disaster recovery and business continuity experience. So let's get into COVID-19 and some reopening strategies. So very important first, I want to start with how you can protect yourself. Obviously, the most important thing to do is to frequently wash your hands with soap. If you can't use soap and water and wash your hands, hand sanitizer is a good backup if you can't. Also, you need to cover your cough with the bend of your elbow or a tissue. And then you need to maintain that social distancing of 6 to 8 feet from people, especially folks who are coughing and sneezing. And I do have information up there on the CDC's website that has a good fact sheet actually that you can print out for your family, for your employees, so that you can have it available. It's actually a really good quick fact sheet on protecting yourself. In terms of protecting your business, we're going to get into some of the steps later on, but one of the most common questions that we have is related to cleaning, environmental cleaning of the business. And currently the CDC is recommending that you routinely clean all frequently touched surfaces in your workplace, especially workplace workstations, countertops, doorknobs, handles, buttons, things like that. And don't go out and buy super expensive or fancy or corrosive cleaning materials. The CDC is recommending that you use the cleaning agents that are usually used in these areas and that you follow the directions on the label. So no additional disinfection beyond routine cleaning is recommended. And then provide disposable wipes so that commonly used surfaces, as I mentioned, can be wiped down by employees after each use. By now, you're used to being in the grocery store. When each customer goes through, they wipe down the counter, they wipe down the conveyor belt, and they kind of sanitize everything. And we encourage businesses too to check your maintenance contracts and your cleaning supplies and your materials to make sure that you have enough, because you're going to have increased demand and usage. And obviously those materials are very hard to come by these days in terms of different cleaning products. And then I did include the link up there for the CDC's interim guidance for businesses and employers. This is a really good website that even gets into industry specific information. So I would strongly encourage you to check it out because it's a good way for you to get smart in terms of how you can protect your business and your employees. So let's get right into phased reopening. There's been a couple of developments with this in terms of kind of some federal guidance, some state guidance. So I want to provide you with some information so that you can kind of make the best preparations for your business. Before I get into that though, I did want to note that their OSHA, as the source notes, has a really good occupational risk pyramid for COVID-19 that does outline kind of like very high risk, medium, low. And so I think depending on your industry, depending on the type of business that you have, you need to be aware of that. Obviously, if you're in healthcare, You're going to be very high risk if you're any kind of deliveries and things like that. Anything with cinemas, sports centers, any kind of big, large venues, those are going to have high exposure. Anything that has frequent contact with customers, retail, restaurants, things like that, you're going to be under medium exposure. And then the lower exposure is going to be jobs that don't require contact with people. Those could be kind of like remote call centers and things like that. But I would encourage you, just pay attention to that because you want to know what's your risk based on your industry and type of business. So the first thing we need to know is kind of what is the criteria that's going to start a phased reopening. And the White House released its guidelines for a 3-phased approach for reopening. But I would note that basically it's going to be up to each state, each county, each city on how they implement that. And it could be implemented differently depending on local conditions and industries. But generally there is established 3 criteria for states to follow when they're reopening. First, states must see a decline in COVID-19 cases for 14 days. The reports of symptoms that might represent undiagnosed COVID-19 cases are also in decline for 14 days. And then number 3, hospitals in the state should have enough capacity to handle cases without operating in crisis mode. And they have to have a robust testing program for healthcare workers. So basically all those are related to kind of tracking cases and being aware of kind of how cases are doing. In regards to the 3 phases, first, basically, phase 1 would be related to restaurants, movie theaters, sporting venues, gyms. They can reopen with strict social distancing. Elective surgeries can resume when appropriate via outpatient services. Under phase 1, bars and schools would still remain closed because those are kind of high traffic areas where a lot of people congregate. Under phase 2, restaurants, movie theaters, and other large venues can operate under moderate social distancing rules, and then non-essential travel can resume, and bars can operate with diminished standing room capacity. Under phase 3, basically employers can resume unrestricted staffing of workplaces, and also large public venues can operate under limited social distancing rules. But I would note for phase 3 that vulnerable individuals, they can get back out in public, but they still have to maintain that social distancing. So that kind of outlines the 3 phases at the federal level. I really didn't want to spend too much time on that, but I do have the link up there from the website if you want to see it. So you can find out more information. But I really wanted to focus more on Florida because obviously that's where we live. So in regards to Florida, on April 29th, Governor DeSantis announced the Safe, Smart, Step-by-Step plan for Florida's recovery. And this plan kind of has a couple of principles just like the other one. They focused on public health and safety, healthcare system readiness, protection of the vulnerable, economic recovery, protection of civil liberties and maintaining individual rights, public confidence, and partnership with local communities. So with those guidelines in mind, here's kind of what they announced. Phase 1 of the plan is going to begin on Monday, May 4th. It's important to stress, though, that Miami-Dade County, Broward, and Palm Beach are excluded as at the time we're recording the webinar because we still have high numbers of COVID-19 cases in those areas. And then I also mentioned that basically it also is subject to local governments, and local governments can decide and kind of make their own decisions. So this is like with the federal level, this is a guide from the state of Florida. So the components of the plan, again, to reiterate, subject to local governments allowing it, is that restaurants can reopen at 25% capacity indoors. They can have higher capacity if they have outdoor seating, but you're still going to have to monitor social distancing and kind of space things out based on best practices in other areas. And I'll mention that when we get into it a little later. Retail shops can also reopen at 25% capacity. Hospital and surgical centers can begin restarting non-essential elective procedures, but only if they have sufficient medical supplies and if they agree to assist nursing homes prevent and respond to outbreaks. The elderly and those with underlying health conditions are still encouraged to shelter in place. Those who do go out should not socialize in big groups of 10 or more people without proper social distancing. And then under phase 1, bars, gyms, movie theaters, kind of like large venues, are still closed. So now that we went over with Florida, let's talk about some business considerations that you can start planning for now for when you reopen. What I want to mention to you is the most important thing that you need to factor in is the reopening is how to best protect yourselves, how to best protect your employees, and how to best protect your customers. That's going to be the most important thing that's going to be factored in for all these businesses, because it's kind of like you let the genie out of the bottle. The steps that you take beforehand are key, and you should not open your doors and be back open until you're confident that you have the best plan in place. So I'm going to reiterate that you need to have your plan in place for what you're going to do for your business to protect your employees, to protect your customers, to protect yourself. You don't want to basically not have a good plan in place before you reopen. And for a lot of businesses, they're basically making that decision based on the guidelines from the state of Florida. And I want to note that COVID-19 preparations and operations, they're going to differ among each business depending on your industry, your product or service, your location, your size, your type of customers, things like that. So each business needs to make that decision based on kind of your own unique circumstances. And you're also going to follow state guidance and also local guidance when you're doing that. So what I did want to note for you just before I get into it is this is actually a diagram. This is from the Center for Disease Control's Emerging Infectious Disease Journal. And this is actually a diagram that shows how an AC unit in a restaurant in Guangzhou, China, helped infect 9 people with the coronavirus. And you're going to see at the middle table, A1, that is a patient that was infected with COVID-19. But they were asymptomatic, like some folks are asymptomatic. They don't show any symptoms, but they basically are able to be contagious. And they basically dine with their family at that table, and the family is A2 to A5, on January 24th. The air conditioner, as you can see the airflow from the arrows, they picked up the air droplets from the breath of that patient and blew them around the room. And the water droplets usually don't travel more than a meter without assistance. But basically, because of the air conditioner and how this is highly contagious, 9 other people, including 4 members of the A table, 3 of the B table, identified by circles, and 2 of the C table, again identified by circles, later tested positive for COVID-19, and they did contact tracing, and they traced it back to A1, that was at the table. And basically in the journal, they wrote that the key factor for infection was the direction of the airflow, that basically the droplet transmission was prompted by an air-conditioned ventilation. So I just want to use this example, not to scare you, but to show you how highly contagious this is and how you need to take proper steps to do social distancing, to have personal protective equipment. You need to have all that stuff in place. If it's shields, glass shields and things like that to protect your customers, your employees, and you, because this virus is highly contagious. So with that, let's get it back into the presentation. And then as the slide notes, once stay-at-home orders are lifted, customers and workers are expected to be open to strict safety protocols as a trade-off so that they can get back to work and commerce. So you need to follow basically these guidance and make sure you're implementing, the safety protocols to protect everybody, because the customers and your employees, they're going to be willing to trade off getting back to work or getting back to shopping if you do take the proper steps to protect them. And then as I noted, you can expect states, counties, and cities to decide when each business can open their doors and under what conditions they can reopen. So to prepare, what we can do is we can look at some of these essential industries for best practices from other states or other countries on how you can get your business ready. So first off, the best practices related to customers is they do limited capacity. So as we noted from the governor's order, he limited capacity to 25% capacity for restaurants indoors, 25% capacity for retail. You'll also notice in grocery stores, they have basically one-way aisles with tape and stickers. Some are like partitioned off. Those are things that you should consider because you want to have everybody going in one direction and don't have people coming face to face or congregating together where they're going to basically interact and spread the virus. So that depending on your location, how it's set up, those are things that you can consider. Also, obviously, spacing out customers at checkout, that can be done easily with tape. Putting some duct tape on the floor and basically spacing everybody out to make sure that everybody is distanced about 6 feet apart so there's no transmission. Also, you'll notice that a lot of drive-through restaurants, they do have a shield that protects the people inside from the people outside and vice versa. So even in grocery stores now, they're having that shield that protects the cashier from the customer. So those are things that you can think about depending on your setup for your business. Also including contact-free checkout options. Sometimes they can basically hand you the card scanner and you can basically slide your card in where you're not touching the buttons or anything. Obviously, providing personal protective equipment for your employees is not going to just protect them, but it's also going to protect the customers. And then kind of a no-brainer is removing display samples. So not having cheese plates, snacks, not having like cosmetics, perfume, things like that out that people are going to try because multiple people are going to touch it and it's going to spread the virus out. Also, related to employees, one of the best practices that we've seen from other states was to set up a temperature checking station each time employees are entering for their shift. What they do is you don't need to buy a thermometer for every employee. You can have 1 or 2 thermometers and you can basically check the employee's temperature when they're checking in, just like they would do with their time card or going to like one of the kiosks and basically entering in stuff. You can basically check their temperature and make sure that they're 99.8 or below so that they can enter the building. If they do have a higher temperature, that might flag for you that you might want to send them home before they get infected, your employees or your customers. And it's a good way to kind of stop that. And it's a good way to do it if you set the process and procedures up because you can check at each shift. Obviously, face masks, rubber gloves. I would also mention you got to have a good process for how they dispose of the PPE after shifts. So the general guidance has been that you can dispose of it in regular trash cans, but you're going to want to have a process for doing that. Obviously, frequently cleaning and disinfecting surfaces that are touched by customers or multiple people. That's counters, display cases, conveyor belts if it's kind of like a grocery store, things like that. Also, something that I really like was scheduling hand washing breaks for like the folks that are at the front lines. And it's one thing if you schedule the hand washing breaks, but it's another thing, kind of the next step, the advanced level, is to have relief staff that can come in and allow people to go take those breaks. Because obviously if you have your cashiers or somebody on customer service that's out, then they're not going to be able to help customers. So that might create a backlog. So you want to factor that in. And then obviously you need to think about protocols for infected employees. So that's something you want to keep in mind. I would strongly encourage you again to check out this Center for Disease Control website. They have really good guidance and frequently asked questions that's available for businesses. And so I have the link up there in the slide. In terms of some back to business strategies, so now that I've given you kind of the tough stuff or the health and safety stuff, let's get into some strategies you can incorporate for your business. The number one most important back to business item is, I was being sneaky, is to basically make sure you take proper steps to protect your customers and your employees. As I noted, it's kind of like the Roach Report effect. Every city, every newspaper, every news station has a roach report where they basically go by the health inspector and they note who has roaches, who has rats, who has health violations, slime in the ice machine or whatever else they have. And no business wants to be on that if you're in the restaurant or retail side. You don't want to be in that aspect. So for COVID-19, you definitely don't want to be that business that's featured on the news that has employees or customers that got sick. You also don't want to be, cited by health folks for like violations. So you want to take proper steps to protect your customers, your employees, and yourself. And this is important on the marketing side because any good marketing strategies you have, any good business models that you have to bring in customers, it's all going to be for naught if you have a bad PR, negative hit from not protecting your customers. And just think about it from a perspective of if you're a customer coming in, if they walk in and they see, gloves, they see masks, they see wiping down things, they see things marked off, they see spaces between customers, that's going to know that you're looking out for your customer, and that's going to encourage them to come back. Versus you come in, no gloves, no mask, people are coughing on each other, you just don't feel safe. That's the first time that customer is going to be there, and it's probably the last time. They might even not even stay to do a sale. So you want to factor that in. So whether you're manufacturing, construction, retail, restaurants, professional services, you want to basically think about that, because any negative customer reactions or local press is going to hurt your business. In terms of a good marketing strategy, I was going to encourage you to check out Google's COVID-19 marketing playbook. It's based on their observations on how businesses are dealing with the pandemic. The handbook basically frames recovery in 3 phases: respond, rebuild, and then recover and reframe. Because a lot of businesses, you're going to have to adjust to that new normal. So you're going to have to kind of get in that recovery phase, but also you might have to change some marketing strategies. You might have to change some of your business operations. You might have to change your model. And also in terms of the marketing strategy, they set it up in 3 phases. So you're going to look at customer insights to drive your approach, assessing the impact on your business from COVID-19, and then taking, really good action and steps now to kind of make some changes. So I did include the link up there so that you can basically check out the full playbook, but you can also just search for Google's COVID-19 marketing playbook. If you want to use Google, maybe it'll come up quicker. But basically, it's a really good handbook and a good place to start. In terms of your customers, as I noted, you're going to want to monitor state and local guidance regarding any changes to your occupancy rates or your hours of operation. You're going to want to update your website to let customers know if you have any impacts to your ordering, your shipping, your inventory, kind of like what's your operation status, and then when you expect to reopen. You're also going to want to kind of be reviewing your partner or your competitor websites to learn about their status and kind of see any best practices that they have. And then where appropriate, start planning now for what special promotions you're going to use to raise awareness. Obviously, it's always good to thank healthcare workers and offer specials or deals for them. But your customers really well, so you can think about kind of what are the best promotions to raise awareness and entice those customers back. And you might want to do it, the first week or 2 just to get people back in the door. Also, don't forget that you can encourage longtime customers to purchase gift cards that you can basically put your business in a good shape, because you can get that immediate cash into your business. And I'm going to kind of stress this for you because a lot of businesses were caught flat-footed because they didn't have a gift card program in place. And it's not extremely difficult to set it up, but it is tough to do, once everything is shut down. So I'm encouraging businesses to think about this, because you might have to factor that they might have to snap back restrictions. They might have to snap back some of the phased reopenings depending on how cases go. And, obviously, knock on wood, we're hoping that doesn't happen. But this is going to make your business a lot stronger if they do have to do some other phased closings or cut back hours or occupancy. It's really good for your business to have a gift card program, especially if you're in retail or restaurants. And the good thing is it can be used online, it can be used in person, when conditions approve. So it's a good way to get it going. And also it's a good way for you to emphasize in your marketing: buy local, shop small, support local businesses. So it's a good way to emphasize that when operations are kind of scaled back or shut down. I did want to put a little bit of time on takeout orders and delivery services, because a lot of restaurants and grocery stores did shift to that heavily to compensate for the loss of in-store traffic. When you're revising your marketing in response to COVID-19, definitely consider offering discounts for takeout orders if you're a restaurant, or if you have any first-time users that are ordering delivery services from restaurants or groceries. There's a way for you to do that. No delivery fees, takeout orders, things like that. And then also, depending on how your business is set up, like what's your location, you can make it easier for takeout orders by offering curbside pickup. And so that's something you can probably coordinate with your business and also just monitor those local conditions. I would also emphasize a lot of businesses are on a lot of these different delivery apps, but they don't really market it well. They don't put it on their website. They don't put it on social media. A lot of customers are very loyal and they want to support local businesses. So if you don't emphasize which apps you're on, because not everybody is on all these apps that are listed. So you want to basically emphasize which ones you're on so that people can have that app and look for you. And so I did put a quick rundown on some of the most popular services from DoorDash all the way down to Instacart. And I want to just encourage you to do your research on how the deliveries work, how much in fees they charge, what's the speed that they get the deliveries out, and then how and when you're going to receive your payments. Those are things to do your research ahead of time so that you know what to expect and you don't get signed up to something that maybe won't work for your particular business. But it's very important that you set up your internal process and procedures on how to handle third-party delivery orders, because a lot of businesses don't think that through. But that can impact your orders, that can impact your customers, and that can hurt your business, because the delivery services are going to deliver the orders, but a customer is going to hold you responsible if there's any errors. If there's like a bag, like the other day I ordered from a local restaurant, and when I got the stuff, all the soup had spilled in the bag. So obviously they didn't seal it properly to get it. There's things you can do also to make sure that it's hot, make sure it's packed properly, put in utensils. So you just need to have your process in place on how you do that, because that could impact your brand, that can impact your bottom line. In terms of long-term considerations, like it or not, now pandemics are part of the business continuity planning for businesses. So it's something you have to factor in. And everybody's hoping we don't have, we get through, we bend the curve, we don't have any other flare-ups, but this could be something that pops up in the fall. It could be something that comes up again. So now you have to plan for pandemics. So as such, we're strongly encouraging businesses to give strong consideration to strengthening e-commerce and also direct-to-consumer sales if they weren't doing it already. Businesses, it's been shown, that had these sales channels in place, along with the marketing that goes with it, they saw their sales skyrocket. While the traditional bricks and mortar offerings, they suffered through those shelter-in-place orders because they didn't have e-commerce set up. They weren't able to basically get sales through other means. So that's something you want to factor in now, and that's something you want to revisit as part of your business model and your business strategy. Also, secondly, you want to consider that a one-size-fits-all marketing strategy doesn't work when you have each locality which you operate in has different restrictions or numbers of cases related to COVID-19. So an example is if you're in one city or one county, one could be a hotspot and one couldn't. So you can't really do like a one-size-fits-all marketing campaign, because it might be insensitive in one area and it might be just right in another area. So you want to ensure that your marketing strategies are agile and that you can quickly change the message to avoid any additional cost or any delays. And also I would emphasize for you that a lot of the marketing campaigns that have been running right now, They've been very empathetic. They focused on kind of, recognizing their employees that are working hard, that are kind of on the front lines. They've been thanking healthcare workers. So you also need to kind of manage the tone of your marketing to recognize you can't be like in people's face, sell, sell, sell. You have to be more, sometimes focused on more brand awareness than you would focusing on sales. So that's something that you can work out when you're thinking through the strategy. So let's talk as we close out in terms of some business continuity steps, because I always say business continuity can actually give you a competitive advantage, because look at all the businesses that had done preparations prior to COVID-19 and had some of these key components that they were able to keep operating while other businesses were shut down. So you definitely, in this case, want to be that turtle and not be the rabbit. You want to have the tools in place to kind of get you ahead. So first off, you want to think about what makes your business run. Like who runs your business? What runs it? Where does it run? How does it run? You want to think about your functions for your business. You want to think about what's a critical function, what's an important function, what's non-essential. Obviously anything related to sales, obviously things related to HR, operations, access to your building, things like that. Sometimes those are things that are critical. And I guarantee you, because of COVID-19, you pretty much know now what is non-essential and what is critical and what's important. You want to think through for your business, how long can you withstand an interruption to those critical functions? No, I know up there I have like 24 hours, 48 hours, 72 hours. For some of the businesses right now, it's been like 3 weeks, 4 weeks, so you got to think through kind of how long can you withstand an interruption to those functions? And also what are some mitigations you can take or some steps you can take now to minimize the downtime? Obviously, you want to think about your supply chain. So you want to think about upstream your suppliers. You want to think about you and your employees kind of in the middle. And then you want to think about downstream your customers. You want to think through kind of what's the impact for everything. In terms of your suppliers and contractors, you want to maintain that vendor information so that you can basically follow up with them. You want to have alternate contacts, primary contacts, also your account numbers. You want to think through if they have a continuity plan, because that can impact you if they can't provide services to you. In that case, you also might want to have some alternate suppliers. Geographic diversity is always good, especially with hurricanes or with pandemics like this, because you might have one area that's shut down, but another area might be open. So you would talk about like Georgia versus Texas, or California versus another area. And then you also want to place periodic orders so that you can maintain an active status with those suppliers. In terms of insurance, one of the things you want to do is related to communicable diseases and viruses. You want to basically be aware that you need to know what you're covered for and what you're not covered for. So you want to kind of just pay attention to that, because you did have, after the SARS outbreak, some insurance companies were excluding losses that were incurred by those particular diseases. So you just want to factor that in. And also for your business, you want to basically, factor in if there's additional things that you want to get covered, things that you aren't covered for, walk through with your agent on how you can improve it. You also might want to shop around if you're not getting the responses that you want from your insurance agent. So those are things to consider. As I stated previously, you want to take steps to protect you and your employees from the virus. You want to have up-to-date contact information. You want to have emergency contacts in case something happens. Alternate means of communication. Nowadays people are using Slack for their teams. They're using WhatsApp groups, obviously text messages sometimes. So you want to have multiple ways to communicate with your team, especially if it's related to disaster information. Also, working with your employees on personal disaster plans is going to pay dividends later on. Allowing people to work from home, to telework when possible. Working with them also if there's childcare considerations, if there's elderly relatives that they have to care for. Those are things that you want to know about and be sensitive to, and factor that into not just your business's planning, but also their personal disaster plan. In terms of some additional links, I did include some links up there for the CDC. They have a really great frequently asked questions section that's available. Also, the Florida Department of Health does have a really good website specifically for businesses and information for like a resource toolkit. The World Health Organization has a good FAQ. The U.S. Chamber of Commerce has a good website. I would also encourage you to check out the Florida Chamber's website as well. And then you do have some industry specific ones related to the National Grocers Association, and also the Food Industry Association has some good guidance for their industries as well. So with that, I just want to thank you for watching. I also want to thank the Florida Chamber of Commerce, and just want to encourage you guys to definitely think through your planning, be safe, and just think kind of long term, because I think together as a community and as a state, we can get through this. And so just do everything you can now to make your business more resilient, so that we can all get through this together. So with that, thank you much for your time, and take care.